Every day a provider is not enrolled in Medicare is a day that provider cannot bill the federal government. A stuck Medicare PECOS application directly stops cash flow. The industry average first-pass approval rate for these applications sits between 60 and 70%. That means roughly 1 in 3 submissions encounters a delay or an outright denial. This chart compares a standard approval timeline with a denial timeline. A physician generating $30,000 a month who hits a 90-day delay faces up to $90,000 in suspended revenue before the paperwork clears. 8 out of 10 of those costly delays trace back to a predictable set of mistakes: NPI mismatches, incorrect MAC routing, and missing 855R reassignment forms. The system itself is not impossibly complex. The financial damage happens because generalist in-house staff simply do not file enough applications to recognize these specific failure modes before submission. Relying on a single internal administrative employee creates a severe structural bottleneck. Medical operations support staff currently see a turnover rate of approximately 33%. When the one person handling credentialing leaves, the institutional knowledge vanishes with them. Revalidation notices are missed, deadlines pass, and provider billing privileges are deactivated. Navigating enrollment systems like PECOS 2.0 requires resilient, continuous operational workflows rather than fragile reliance on a single internal hire. The most effective countermeasure is moving credentialing to a dedicated, outsourced team that processes dozens of applications every month. Services like Staffingly combine AI-driven automated pre-checks with human expert review. The AI cross-references NPI and MAC data, while credentialing leads make the necessary judgment calls to catch errors before filing. A fully loaded in-house coordinator costs between $65,000 and $95,000 annually. Staffingly provides a dedicated Medicare enrollment service for $390 a week. With high-volume processing, this dedicated service achieves a first-pass approval rate above 90%. This creates a very clear operational arbitrage. Practices cut credentialing overhead by up to 78% while simultaneously upgrading filing accuracy and protecting their revenue pipeline. Deployment takes 14 days. The process begins with a comprehensive audit of your current provider roster and NPI cross-referencing to ensure all data matches CMS records. Practice leadership maintains total visibility without doing the manual tracking. A weekly KPI dashboard reports directly on active panels, submitted applications, and payer days outstanding. Because PECOS data includes protected health information, the security infrastructure is non-negotiable. Processing must be handled by vendors that are HIPAA compliant, SOC 2 Type 2 certified, ISO 27001 certified, and HITRUST aligned. Engagements are structured to minimize risk, operating on a month-to-month basis, after a 14-day pilot with no long-term contracts.